Palliative care nurses come in all shapes and sizes, so there's no one type of person who makes a great palliative care nurse. Palliative care nursing can be tough sometimes, it can be sad sometimes, but the rewards outweigh those sad times, and on the whole it's extremely fulfilling.
Why? Because it's a really interesting, challenging, complex kind of nursing work.
When the symptoms managed and they're surrounded by the family, we call it good death. You know, it's good for the family and the patients as well.
So for Rodney, we're coming, it's either from every week, every 2 weeks, every few days. It all depends on how they actually are at that present moment. But it is a very scary thing for them, but we try and take the scariness out of it, just so they can have that important time with their loved ones.
Chronic illnesses can have quite a different experience to patients with cancer, for example. And the journey can be a lot more uncertain. It can be many years of slowly deteriorating function with big episodes where they're acutely unwell. We're not just about those end stages where things are changing, but we're able to help them maximise their function at home, do the things that they want to do.
Well, he's got cardiovascular disease and had both legs amputated, and he has end-stage heart failure. Oh, they come and observe him, they help with the medication, they suggest things, you know, get the OT to come out for needs that he needs, like wheelchair commode. And
with palliative care, it's actually lovely to actually be in their own home and give those patients their wishes and to actually discuss those things so that their wishes can be fulfilled.
He doesn't want to go back to hospital. I've had a discussion a year ago about it, so not to go to hospital to die.
As Rod continues to become more unwell, nobody needs to panic. Everybody knows what the focus of care is, and the focus of care is to keep Rod comfortable and at home.
It just makes me feel safe that I've got someone to call on. It's probably good sometimes to actually talk about it. We haven't given a time frame, we just know it's end-stage heart failure and there's nothing more they can do for his heart. So just having these people here to monitor it makes a big difference.
I don't have to sort of worry as much about her as I did, although I do, but you know, I know she's going to be looked after and have that support, you know, when I go, so that's good.
Helping me understand is a lot of it too.
To help somebody die comfortably at home is extraordinarily intimate.
Rod isn't good really at saying he needs help. He's starting to understand that we need these people to come in. So, yeah, right. Here it is. And I say I've got no family yet. So these people will be my family, basically.
This is something that, again, is the strength of community nursing, being able to provide that care to the family as a support unit, not just to the patient themselves.
You develop a unique relationship with the patient and the carers and the family.
You get a very special relationship with them and they trust you. And when you say it, you promise something, you do it.
I guess if anyone's thinking about palliative care nursing, if they could think that it is achievable, it's not that scary, and we're all nice and we're very supportive.
Helping somebody to die comfortably in a place and setting surrounded by their friends and family where they want to be is enormously satisfying.
I am a much better person for having worked in palliative care.
Challenging job and I really love it.
I couldn't think of doing anything different. I love every day is a bit different. You never know what you're going to go to every day, so that always keeps you on your toes, which is great.